Hey guys, I'm Daudi.
I'm Coach Atamba from ALT Lifestyle, Health and Fitness, and today we're going to talk about diabetes type 2.
Diabetes. Now, we all know what diabetes is, right? Diabetes is sukari.
Sukari, that's how we know it.
Sukari. I think it's one of the top 5 killers in the world right now.
Right.
Causes of death. This is very vital. We're saving your lives here. We're saving your lives. What is
diabetes mellitus type 2? Guys, adult onset. Talk about the diabetes adult onset.
This means that you're most likely to get this in your
30s onwards, because you're up for it these days.
Yeah.
By 30, they are pre-diabetic.
Keep in mind, of late, the trends have been showing us being coming down. Like, people are doing this while they're younger. They're getting this while they're younger, and it's one of those things whereby I think it's more of a lifestyle thing for people.
True.
We're eating more, we're being less active.
Yeah.
Diabetes is a chronic condition that is that affects the way your body metabolizes sugar.
Exactly.
Or glucose in this case. Glucose is an important source of fuel for your body. When we say glucose, where does the glucose come from? Because it's not like you're actually leaking glucose buckets.
So whatever carbohydrate you eat, posho, rice, bread, potatoes, maize, the end of the day, your body has to break it down to a substance that it can use as energy in your muscle cells. So all that is broken down to glucose.
Glucose, yes. So this means anything you eat, not just the candies.
Anything you eat.
Posho, white rice,
brown rice, couscous,
anything. The falafel we had for dinner yesterday, it counts too. So anyway, yes.
It's all broken down to glucose in your body after digestion. So glucose is a substance that your body can then use as an energy source. Okay?
She's completely right. So we've talked about glucose. Now let's talk about the way
that glucose gets into your muscle cells.
Yes. And that is regulated by a hormone called, and I'm sure you've had this,
insulin.
Now, insulin is, where is insulin produced? It's produced in the pancreas. By the beta cells. They're called beta cells. You don't have to worry about why they're called beta. They're called beta cells. That's the name. We found it that way.
When your body breaks down to your food to glucose, the glucose is in your bloodstream. What helps take that glucose to your muscle cells so that they can use them as energy is
insulin. We have to think of it like a gate man. It's the gate man.
It's what lets
Askari.
Exactly, the glucose into your muscle cells to then, have
be
energy
metabolized.
Exactly.
Because your body needs energy. Very simply put, your resistance to the insulin increases over time as you grow older. This can be to a variety of factors, For example, aging, your diet, and lack of activity. But we'll talk about this a little bit more, but essentially think of it as your body becoming more resistant to that hormone, that particular hormone which regulates the glucose in your body. Right? Your body does not recognize it as carry anymore. Exactly.
So there's nothing to take that glucose to your muscle cells. So that glucose stays in your blood and keeps going up and up and up. So when your blood glucose levels are above like 11, that's when you say you have sukari.
You have sukari.
So there's nothing taking that glucose to your muscle cells. So it just keeps going up.
Yeah, the doctor gives you that grim look. I'm sorry.
You have diabetes.
The risk factors
that make you more prone to having this.
Why should you be scared?
Sadly, Africans, Black Americans,
Black people,
we just genetically more predisposed to having diabetes.
Unfortunately. I don't know why that is.
We have age, older age, and we have obesity.
Yes,
it's always a thing.
It's always a thing. We can't help it. And another thing is lack of activity. People who sit all day. People who call me and tell me, like, I don't want to do a workout. What can I do? I'm sorry, you have to do the workouts. Okay, at least you have to be active. You have to walk. You have to do something. Sitting all day.
Whatever way you can fix in an activity, please do it.
Yes.
Yeah, please. If you can take the stairs, take the stairs. You can jog home. If you can, just dance with your children at night.
Dance in the clubs. Don't just sit on a chair and watch the ladies.
Please be active. Yes.
Exactly. I was reading something. Someone was saying it's not these grand gestures that really make the difference. It's these small things you add to your life that really impact you in such a meaningful way, right? They really affect your health. Like, for example, she said taking the stairs. It's not something you think about, but doing that every day, it adds up. It's very important.
Rather than do like a planned challenge for 1 month and give up, you can just do 15 minutes of exercise daily, please.
Just skip a rope. skip rope, you know, play with your kids, have fun.
How do you tell you're getting diabetic?
First thing you're going to notice is you're thirsty. And I'm not talking about that kind of thirst that you guys usually talk about. You want to drink water, right?
All the time.
All the time. You get really thirsty. And the reason for that is your body is literally saturated with sugar and it needs to be diluted. And in your mind, your brain processes it as, oh, I'm probably just not drinking enough
Dehydrated.
water.
You have a thirst, let's say, a thirst sensor in your brain.
Yes.
So when blood goes over it and it's viscous and full of sugar, the brain says, oh, we need water. So the thirst sensor goes like, we need water. Yeah.
Next is frequent urination. People always inbox me and they'll be like, oh, but you know, I've peed like 2-3 months. No, you'll be wanting to pee a lot. You definitely know there's a problem.
It's too frequent.
It's way too frequent. That will usually set off alarms for most people. And the next sign is
and at night too.
Exactly. You'll be waking up because you literally could not be able to hold it. Unintended weight loss.
Yes, so is muscle wastage. Because your insulin is not taking your glucose to your muscle cells to be used as energy, the body thinks you're starving. So it essentially eats itself up. Does that make sense?
Weight loss should always be something that you plan for. Over time, it should be gradual. You know, sudden loss of a large amount of weight is, you know.
And you think I'm stressed and I'm losing too much weight in a short time.
Yeah,
no, that's not right.
And then it's really, and if it's not accompanied by anything, you should always be worried. You should always be worried because you know you're not working out, you're not made any changes in your life, you're losing weight. Why? There should be a reason. There should be a reason. The next is fatigue. You're feeling tired. You know, we're all used to feeling tired, you know. I had a long day at work, I'm tired. No, you're tired from morning to the evening, non-stop.
You're sleeping, but you're still tired.
You wake up tired. You go to sleep tired. You eat tired. You're just tired. You're tired. You're a tired person. Essentially, fatigue, prolonged fatigue is really a big, it should set off alarm bells in your head. The next is blood vision. Blood vision. You start to see, again, I wear glasses, right? But it's not that sort of thing. All of a sudden, your eyes, they don't see as well. Why? This needs me to become a little bit technical. I'm sorry.
It's still about viscous blood, so don't get it. You explain glucose being in blood, so it becomes very viscous and thick. And
it damages those little, tiny blood vessels
in your
extremities. Eyes. Yeah, your eyes as well. Your extremities can be your fingers. You usually have people who have diabetes losing body parts.
Feeling.
Yeah.
So you start by losing feeling because when your body part can't access blood, oxygen, and nutrients, you know, to that particular part, it loses feeling, it loses life essentially.
Exactly.
It dies essentially.
It dies, and that's why you often see people with diabetes losing limbs, entire limbs. Why? Due to that damage of those
tiny nerves.
The next is slow healing sores. Now, what does this mean? This means that you get a wound. You know, you have your usual healing time. You know yourself, right? And this is taking way too long. It starts to get infected. It starts to, you know, what people say, my body is rotting, right? That sort of thing.
Rather than forming a scar over it, it's there all the time. It's not healing.
It's not healing.
Wound
You're wondering what's going on. You know, you should be worried.
All this comes from lack of blood supply.
Yes, blood supply to those body parts.
How are you diagnosed? So I know Ugandans say this thing of if you go looking for it, you'll find it. So they never go to hospital to check unless they're in pain or dying. But please, if you're 35 or 30, take your family and find out your blood glucose levels. Just go and do it. Look at it. Yeah. Very 5,000.
Exactly. It's very cheap.
Just find out today what your blood glucose levels are, please. So imagine I've grown up drinking soda. I eat cake, I eat candy, bread, Blue Band, milk tea, sugar, all that honey.
And people have this idea that honey is somehow magically not going to.
It's still sugar,
guys. It's still sugar, guys. It's still, just because it's not sugar doesn't mean it's not sugar.
It's still sugar. So imagine over time, I bombard. That's the word. my body with these refined foods all the time.
And then between these meals, you're also snacking. You're having your banana. You're having your, I don't know.
At least bananas. They're having candy, chocolate. We don't do these things. Sumbis.
You're having your sumbis. You're having your cassava.
Chapati.
Rolex.
Yeah, but every time. And then over time, you lose sensitivity to insulin. Insulin can no longer do its job.
Exactly.
So you realize this is why you've done this to yourself. I'm sorry. Does that sound critical?
It does, a little bit, but keep in mind, the truth, we're being honest with you guys. We're being honest.
Yes, it's a lifestyle disease. Because type 1 is in children, they're born with it. But type 2, you have done this to yourself through what you eat and how you know.
No, guys, we're not judging you. We're not judging. I'm not judging you. She's not judging you.
I'm not judging.
We're not judging anyone. We're just being honest about it. I was raised in a home whereby we eat bread, we eat this, and I'm not saying there's anything wrong with eating bread. I'm just saying you should always watch.
It's all we knew.
Yeah, it's all we knew. I only knew a very carb-rich diet. And it's one of those things whereby, looking back now, educating myself was one of the best things I ever did. It's one of those things that we should always teach yourself, then teach your neighbors.
The next generation. We're here for you on that.
We're here for you.
High body fat percentage and diabetes when you're obese. Obesity.
Yes. Now, the thing with being obese is, I would say I'm not one of those people who advocates for constantly monitoring your weight non-stop, but you should always watch what you know. You should know where you lie. Essentially, you should know that I'm a bit overweight, I'm a bit underweight, I'm reaching obese levels. The way your body looks at fat is this: fat is a storage mechanism for your body. You have excess. The body is like, I'm going to convert this into fat, and I'm going to store it here. So that the next time you're starving, maybe you're hungry, you're working out, and your body needs that extra boost of energy, it burns the fat. Now, with insulin resistance, the fat is stored. Your body doesn't have any place to break down this fat. They don't have any reason, to break it, because your body works logically. It's like, I need to break down this fat. I don't need to break down this fat. Right? Your liver gets overloaded. Your pancreas is like, bro, what's going on? It slowly releases more and more insulin into your bloodstream.
But the insulin is not working.
The insulin is not working.
Receptors. So insulin receptors are the ones that, how do I put this?
Let's call them the gate.
Yeah, the
gate itself.
That is so good. Muscle has more insulin receptors than fat.
Okay.
So just by the fact that you have more fat than muscle, your insulin receptors are less. If you have more muscle than fat, your insulin receptors are more.
Essentially, what you should know is the more muscle. And guys, we're not talking about looking like massive bodybuilders. For example, women always hit me up.
Toned. I'm very toned. I'm very proud to say
she is in great shape. But a lot of women hit us up and be like, "Won't I get bulky?" You won't.
You won't. You don't have testosterone.
You don't have testosterone to that level. So you just have more. You be what people refer to as toned, like Atamba, yeah? And the idea here is that the more muscle the more lean muscle at least you pack on, the higher your insulin sensitivity goes.
Exactly, because your receptors are more in muscle. But the more fat, the less they are, so you're insulin resistant.
The thing with certain diets that have extreme, because people tend to work in extremes. So they tell someone reduce your carbs, they hear no carbs.
They will cut out going to eat a single carb. The entire food group.
Extremely low carb diets actually reduce your insulin resistance. Why? Because your body looks at it as I am under attack. So to preserve the amount of energy that goes to your brain, the amount of glucose that goes to your brain, your body is like, you know what? I'm going to really up my resistance for a while. So with that, I guess you should always be careful. There's always nuance. There's nuance to these things, right?
Tips on how to increase your insulin resistance. Sleep hygiene. You need to have enough sleep in your day. Some of us take sleep to be a luxury and a thing lazy people do, but you need to sleep. All that you put your body through during the day, you recover during the night in that actual deep REM sleep. Not the naps we do, the actual deep sleep in the night. So please, sleep hygiene, important.
It bothers me greatly when people are so proud of the few hours they have slept. It's sleep, guys. Come on.
Wear and tear is real on your body. Drink your water.
Guys.
So for men, 4 liters a day would be good.
Yeah.
For women, 3 liters would be good. Please drink your water.
Drink your water.
Don't tell me you drink tea or juice or yogurt. Drink water. Get
Actual
fresh water and drink it, please.
It's recommended you have at least 30 minutes of moderate exercise or 50 minutes of intense exercise every day. This is cardiovascular, so take a walk, jog home. Get your heart rate up. Essentially, get your heart rate up.
If you've been walking daily for a month and then you realize it's no longer affecting your heart rate, up the intensity, guys. Increase.
And people tend to think of cardio as only this, but like me personally, I have these short little legs. I don't like to run. I suck at this. I suck at running. What I like to do though, there's so many things you could do. You can dance.
I like dancing.
If you like to fight, you can fight.
Jiu-jitsu.
You can fight. There's so many things you can do. You can go rock climbing. Hike. The idea here is this should be lifestyle changes, not things that feel like a burden.
Work to your
Exactly.
Yeah.
Do something you like.
Fiber is just the body of the food you're eating.
Yes. So
when you tear apart a potato, you see strings. When you tear apart a pineapple, you see that is fiber, that actual thing you're chewing. So another tip to increase your insulin sensitivity or reduce insulin resistance.
Yes.
All this is about not getting diabetes.
Yes.
So add more fiber to your diet. So people always think fiber is
people tend to think fiber is like the stuff that you find in like wheat bran, for example, or these fiber pills that you take. She was telling me about earlier.
Those packaged extra fiber foods in the supermarket. No, please. Fiber is the natural foods you eat.
Just to add a little bit to her point. So when you eat something plant-based, there's always that there's a certain part of it that's, for lack of a better word, indigestible.
It is. Right? It is a good word, actually. That's the word to use.
So think of it this way, right? That's why when people are trying to lose weight, they encourage them to eat fibrous foods. Why? Because essentially you'll be filling up, you feel full, but a certain amount of what you eat is going through you. It's good for your digestive system, gut health. It's good for your people who have a lot of problems with stuff like constipation and bloating, and it's good for you.
Literally a win-win situation. You don't have gas, you don't get bloated, you lose quite a good amount of body fat, so you tone up, and then you prevent diabetes.
By the way, we do meal plans. Hit us up.
And the diabetic one is out, so
it is out. We're ready for you. We came ready. We came prepared.
Add protein to your diet.
We've already talked about like how increasing your muscle mass increases your insulin sensitivity, right? And just to add a little bit to this, generally to build muscle, you need a certain amount of protein every day. Why? We learned this in primary school. Protein is a
bodybuilding food.
They are bodybuilding foods.
It builds your muscle.
Eating protein directly contributes to that. Now, I'm not meaning that you shouldn't overdo it. Again, you should not only eat protein foods, because that will not be beneficial to you. The main thing you should take from this is increase your protein intake. Add the fiber.
By the way, fiber is carbs, so
it is carbs. So you begin from your carbs. Reduce the processed foods, right? And that overall will. It's not even your physique. We're not here to talk about physique today.
Inner health.
Your inner health, how good you feel, how healthy you are. And again, diabetes, this comes back to diabetes. You reduce your chances of developing type 2 diabetes later in life. If you do have a person related to you who does have diabetes, who you know of, your chances of developing diabetes are higher. There's a certain genetic element to this, meaning that if you do know someone in your family who has diabetes, you should be taking this especially seriously.
And don't say, in our family we're obese, in our family we get diabetes. No, you can change your lifestyle.
You can change it. It's not
don't
witchcraft.
Let your genetics control you.
Yes, it's
your lifestyle.
Yeah, these are things you can act on. But
how about we make it a good, healthy, long time?
Exactly.
Yeah.
Why not the best of both worlds? It's not a lot of that we're asking from you guys. We're just asking you to mind your health.
My last tip on how to increase your insulin sensitivity is cut out the trans fat. So trans fat is, how do I explain this? I don't want to go into hydrogen and hydrogenization of fat.
That's a lot.
Okay, let's say the fat that is on like some margarines, shortening, trans fat. Processed fat, okay.
Processed fat.
You know there's fat like from plants and avocado, but this is refined processed fat. That's how I want to cut out.
You're thinking about when people talk about very oily foods. That's the kind of fat you're thinking about. You know that you've bitten into a sumbi, it's dripping. That's the fat we're talking about. Now, we're not. I love sumbis. I'm not demonizing sumbis. I'm just giving you an example of the kind of fat that she's talking about. You know, the margarines.
A lot of margarines have trans fat and shortenings, like the ones we used to icing on cake. A lot of trans fat on those.
Exactly. For your health, it's for your sake. You know, again, you don't have to do these things, but it certainly is advisable that you do them. So, guys, to recap, yes.
All the tips to increase insulin sensitivity.
Yes. Sleep
hygiene, drink your water, avoid trans fat, cut out refined foods.
Exactly.
Eat more fiber, eat more protein.
It's very simple, guys. Very simple tips.
More activity.
And yes, more activity. Very simple tips, guys. Again, please just think about these things. Just consider it. Think about us, right? And we have meal plans. Remember, we have meal plans. We're available for personal training.
Yep. And consultations if you want to understand your body more.
Exactly.
So for people who don't want to hear the words protein
something
and fiber,
concrete.
Let's give you actual Ugandan food.
Yeah.
Healthy breakfasts.
Okay.
So you make sure all your breakfast, all your meals have all the food groups. So you have a carbohydrate, a protein, a fiber, and a healthy fat. So let's go. Breakfast. Eggs for protein.
Exactly.
Have your water, please.
Please, water.
Get some tomatoes, make a vegetable omelette. So cut onions, cabbage, cucumbers, anything you want. Tomatoes, carrots, put it in your eggs or omelette. Then fat. Avocado. Get a nice avocado.
Yeah. And again, this is stuff that's very cheap, very available. You don't have to go above and beyond. Very simple things.
Or add spices and herbs to your diet, please. Cinnamon, turmeric, mint, parsley.
Guys, just because health does not mean it has to be bland.
Eat good food.
Eat good food. Enjoy your meals.
Don't say yam, rice, potatoes, matoke.
You'll be overdoing it at that point.
Do one carbohydrate.
Exactly. Guys, let's give an example, right? So, for example, a carbohydrate, take out something. I like sweet potatoes. I love sweet potatoes, right? And again, they're very cheap. They're easy to find. And usually, even like these ladies who sell around town and stuff, they bring them to you steamed. Great. Lovely.
Steamed gonja.
Good. Lovely for you, you know?
Very good.
Exactly.
Carbohydrates and good fiber.
Watching out for those trans fats.
No trans fat.
Exactly.
And then let's say you supper, you don't want to eat food, have a fruit, a bowl of fruits. The more color, the better. Do range.
Exactly.
Don't do just one fruit every time.
It's not only about preventing diabetes, it's about having overall good health.
Healthy lifestyle.
Exactly.
Lastly, another tip diabetic patients forget. Don't binge and then don't say I missed breakfast, so let me now put the things I would have eaten for breakfast at lunch and then add lunch too. Those fluctuations in carb content are not good for your glucose levels. So have roughly the same carb content every meal.
Exactly.
And don't change up the times you eat. Don't say I ate at 1 today, tomorrow I'll eat at 3, tomorrow at 5.
Don't just decide you're doing intermittent fasting out of the blue and then you give it up the next day. Guys, seriously, if you're going to intermittent fast,
please don't. If you have diabetic, please come and see us before you do intermittent fasting.
Like have someone you can see us, or you can go to your doctor. You know, we may not be available. Go to your doctor, consult the doctor before you make these big changes in your life if you're diabetic. Right?
But that's the tip to remember, because people always say my mom didn't feel like eating, so I left her and I gave her the food at 4. No, force that food at the same exact time every day until the blood glucose levels, regulate. Please remember that.
Okay, guys.
That's a free tip, you guys.
It's a free tip, guys. Okay, guys.
That was really fun.
That was really fun. We had a good time talking to you guys. Again, I'm Daudi.
I'm Atamba and
and we had a great time talking to you guys. We're here at
ALT Lifestyle, Health and Fitness, bringing you all the information, all the health information you need. Simplified, but still informative.
Very simple, guys. We'll see you next time.
See you next time. Bye.